My name is Dr. Richard Herman, and I'm part of the Carrollton Orthopaedic group. The reason I went into medicine was because I was able to go on a couple of mission trips when I was a teacher before I got into medicine. I thought that was kind of a unique opportunity to be able to, come into a place where somebody's in need and treat them, have a relationship with them, and get to a deep level pretty quickly. I went into orthopedics because when I was growing up, my dad was kind of a do-it-yourselfer. So we were doing projects around the house all the time, woodworking, well digging, sprinkler systems. There were saws and chisels and hammers around the house all the time. And so when I got exposed to orthopedics in the operating room, it was very similar to things I had grown up doing all along. It was almost like working in an auto shop or a carpenter shop, except just in a kind of a high-tech, fancy way. So I feel like I've been preparing for that role for a long time before I ever got there. I think the greatest joy in being a doctor for me is when you come out on the other side of a treatment plan and things work, and somebody can look at you and say, I'm so much better, and give you that thank you. It gives it's a great sense of satisfaction, a feeling of accomplishment, and at the end of the day, when you can connect with another person and do something that changes their life, I think it makes not just an impact in the world, but it makes an impact in the life of the physician too. You feel like you've really done something that has some meaning in the world. I hope that when patients leave the office, they feel like we have a plan that's in place, that's something they can participate with, something they can get on board with and be excited about, and have hope that they're going to find some relief from whatever it is that, whatever pathology that's brought them in, that they feel like, that we have a plan in place that's going to bring them some success. I chose upper extremity specialty as a subspecialty in orthopedics so that, one, people typically with upper extremity surgery do really well, and that's kind of fun to be a part of. So when people get well, makes you feel like you're doing a good job, so that's part of it. The other is that there's a vast variety of treatment options, pathology that takes place with upper extremity surgery. So I can, in one clinic afternoon, I can see somebody who needs a replacement of a joint. I can see somebody who had trauma and needs fixing of a fracture. I can see a pediatric patient who's in need of treatment. We can treat arthritis that's been there for a long time. It almost encompasses all the other roles of orthopedics into one subspecialty. So there's a ton of variety, which keeps it interesting for me, but also challenging, and something that I feel like I can do for a long time and be really engaged with and not get bored with, to be honest. Carrollton Orthopaedic Clinic is a very unique practice, I think. The guys who work here as physicians are it's a very congenial group. People take care of each other. They're available for questions. They're available to cover each other in case somebody has an emergency and has to leave and go do something, but there's patients who need things. Clinic staff here love working together. They're super supportive of each other and the physicians. Everybody works with a great attitude, and everybody works toward a similar goal. I think at the end of the day, they want patients to be well taken care of and want the operation to run smoothly, and everybody pushing toward that same thing with a great attitude from top to bottom makes it a great place to work.